it's Jenny D, and today's Health Tidbits with Dr. Kohli. We are, of course, going to dive into screen time guidelines. That's a big thing that we've been talking about. If you haven't seen Dr. Kohli on 9 News, where have you been living under a rock? Also, her practice, Cherry Creek Heart in Aurora, accepting new patients, if you guys would like to check that out. So let's start. Under 5 years old, what you should be telling your kids about the screen time?
So the American Academy of Pediatrics, the Canadian Pediatric Society, many other organizations have put their nickel down. So here's what the rules say. Under 2 years old, no screen time whatsoever. Okay, the only screen time you're allowed under the age of 2 is if you're interacting on a tablet with family members.
Okay.
That's only what's recommended. From 2 to 5, it has to be less than an hour a day.
Okay.
And you need to set a timer and enforce that really strictly, because if you don't actually do that, the child can start to develop a lot of behavioral problems, a lot of language issues, and lots of things that can come out of it.
Yeah.
And you know, Jenny, I was shocked to see this, but 98% of American kids are on screens by the age of 2.
Yeah.
Every day.
Well, and I think that was too, like when my kids were younger, it was like the young Einsteins or baby Einsteins. But that was just a gateway.
Right.
It's kind of like a gateway screen time drug to get them to where they are now. And the behavioral issues, I completely understand, because my 9-year-old, man, when you tell her to get off that screen,
It's really hard, right? And you know what? It's addictive. So think about how we're addicted to whether it's coffee or alcohol, or so if you take it away from someone, they get angry, they get grumpy, they get guilty. And from the age of 0 to 5, our brain is like a sponge. That's when it's really developing our attention. It's developing our language. And the way we evolved to develop these types of skills was to interact with other people, not to sit and stare passively at a screen. So what you're seeing is the kids that are using too much screen time, especially before the age of 2, but even between 2 and 5, if they go over an hour, they have trouble with words. They have trouble with vocabulary, trouble with paying attention. Their cognition is a little bit slower.
Okay.
They don't interact socially in the same way. And then, as you pointed out, behaviorally, it's not just the attention, but acting out and tantrums. And, and then, of course, their sleep. You can imagine how this affects their sleep, which then creates all these other problems all over again.
Oh, yeah. And so we're talking about screen time, but more than just time, it's also the content that is a big issue. And that kind of matters. Like, I feel like they're absorbing things that at their age is too young.
That's true. So it's what's in the content, meaning is it too mature for them, but also the pace of the content. So it's funny, I think back to when I was a kid, I used to, a Saturday morning, cartoons. Bad idea.
Oh, yeah.
Okay? Because those cartoons are A, passive, so you're just sitting and sort of staring at the TV. B, they're very fast-paced. So the guidelines tell us the slower the pace of the content, the better it is in terms of the type of content for the child to watch. And ideally, you want some kind of content that's not passive, but it's interactive.
Okay.
So I'm thinking some sort of a tablet game, like a word puzzle, or like some kind of crossword puzzle or treasure hunt on the where they're actually interacting.
We do a lot of
with
the ones that are like, hey, can you tell me which of these people stole the, and so you have 4 different things. And so basically, and we're playing it all together, because that's one of the things that they really love to do. Like, you watch it and then you're like, oh, I think it's this guy because look, he's got paint on his hand. So they're actually getting a lot more out of it than just watching it.
So I
it's
love
like a
that
riddles
too.
or something like that.
So that's the other thing that's in the guidelines is it's co-screen time. So as a parent, it's really easy for us to sometimes say, okay, there's the TV, go, I need my hour to catch up on stuff or whatever. But that's the worst way to do it. So if you put them in front of the TV without yourself being next to them, and as you pointed out, asking them questions or interacting with the content with them, that's actually a worse type of screen time for them.
Yeah.
So really what they recommend is, first of all, you model good behavior. So you limit your own screen time, right? But secondly, if they are going to do that 1 hour screen time, you give them slow-paced educational content. So like my nephew watches Storybots, which is like a little science thing, or Number Blocks, which teaches him about math. And you interact with them while they're watching the content. So even if it's just a TV show, you say, okay, what do you think's going to happen now? Or you pause it and say, okay, if the 5 fell over and fractured into 5 pieces, how many blocks will there be,
Okay.
And so you really get them to sort of engage in a more active fashion.
It's more like educational instead of like, oh, look at this person that's pretending to be an orphan, or what the God, some of the content on there.
Well,
like,
now I'm seeing my nephew with AI-generated content. He's 8 years old.
Yeah.
And he watches these like little AI heads talking and fighting, and like an AI hamster like fighting another AI.
Yeah.
And I'm just blown away as to what our kids are seeing.
Scared a little bit now. Scared a little bit.
Yeah.
So what are some red red flags that your child is watching too many screens?
So this is really important. So I think you pointed out one, which was behavioral issues, right? If you're seeing the volume of their emotional reactions turn too high,
Okay.
that's a bad sign.
Okay.
That means they may not be processing information in the same way. Language is the other one. Okay. So if you're seeing it takes them longer to either respond to you, they have more limited vocabulary, they're using a lot of jargon or vernacular. Of course, if they're using any bad words, these are all signs that they may be spending too much time on the screen. And then if their sleep is affected, they either have trouble falling asleep, or when they wake up in the morning, they're not rested. They say they're still tired, they want to sleep more. You have to go into their room and wake them up, set multiple alarm clocks. These are all signs that the screen time may be disrupting their circadian rhythm, which is how they sleep.
That's scary.
Yeah.
So what are some practice rules for screens that pediatricians suggest to kind of implement in your home?
Yeah. So the biggest one, no screens at meal times. Okay. This is a big one because we have the tendency as well to pull out our phone while we're eating, or maybe have the TV on while we're having dinner. None of that. You really want meal times to be protected, sacred times. Number 2, whenever possible, try to swap a screen for something more active, even if it's a board game. So if it's cold outside or raining or whatever, a board game is a little bit more interactive than something on the screen. So as easy it is to play chess on a tablet, maybe get a real board out so that you're not
tactile.
Yes.
Okay.
And you're not stimulating the eyes and the retina in the same way. Number 3, at least an hour before bedtime, cut them off.
Okay.
Yeah. So as much as, sometimes we do this too. We get in bed and we turn on the TV to help us sort of relax from the day. Not a good idea, because as soon as your retina sees that light, it stimulates your brain.
What about sleep tube and things like that? That's something that they do at their dad's house, and that's something that I've always wondered. Does it help their sleep?
So tell me about sleep tube.
So sleep tube, it's you have and you like music in the background, and is
it on a TV or is it just auditory?
It's on a TV.
So put it auditory.
Okay.
Yeah. And one of the things I've really started liking is these alarm clocks that give light. And so in the morning, when you set an alarm clock in your child's room, you don't just want the noise, you want the light as well, because that starts to
Slowly
get them ready
wakes
for
them
the
up.
day. And same thing at night. So sleep tube sounds like a great idea, because a wind down routine before bed I love. But as long as it's not on the TV, because that blue light is again getting into your eyes. But if it's just coming from some sort of auditory equipment, you turn down the lights, you listen to some music, you hear a sleep story, that is a perfect way to wind down from the day.
Okay.
Yeah.
I'm not winning at this parenting thing. So screen time, make sure that you're, kind of just doing a health check. It is the middle of spring, so it's a great opportunity for you to kind of switch up some of those before we get into summer, because summer, that's a really hard one to kind of keep them off the screens as much as we possibly can.
It's really hard, but we got to keep trying. It's a drug, and so we've got to make sure we limit it for our kids. Our brains did not evolve for screens.
Yep, they did not. All right, Dr. Kohli, come watch her on 9 News, Cherry Creek Heart in Aurora. Call her up.